Joining me now, Democratic Congresswoman Debbie Wasserman Schultz of Florida, who's assuming a new Democratic leadership role. She'll be co-vice chair of the Democrats' Steering and Policy Committee. Congresswoman, congratulations on your new leadership role, and thanks for joining us. Absolutely. Let's get to what we're hearing already from the House Republicans, the date Wednesday in which they want to tackle the repeal of this health care law. What's your response to that? And by the way, the Republicans are saying it is because the health care law is a jobs killer, which is a part of your focus. Your new leadership role is job creation.
Look, the Republicans tomorrow are going to be engaged in hypocrisy on day one. They spent the whole campaign talking about the importance of creating jobs and turning the economy around and reducing the deficit. That's the yardstick that Democrats are going to be measuring their proposals by. On day one tomorrow, they're going to propose a repeal of health care reform, which will explode the deficit, which will actually kill jobs, and which will do nothing to make sure that the people who have been able to be covered by health insurance reform not be dropped or denied coverage for pre-existing conditions, seniors who've had cuts in their prescription drugs, that would all be taken away if they are successful, and we're not going to allow them to do it. Tamron, every minute that the Republicans spend obsessed with repealing health care reform and doing it fruitlessly is one less minute that we're focusing on creating jobs and turning the economy around and reducing the deficit. It's irresponsible.
Well, obviously, many believe that the goal here really is to send a message to the Republican base, and also perhaps if you can woo a few Democrats in, this would be an embarrassment to those lawmakers on the other side of the aisle. So they're not necessarily looking for mission accomplished, but they are looking to score some victory points here. I want to shift to spending, though, because you've got Republicans promising $100 billion in spending cuts. They have not said exactly where those cuts will take place, but they've noted no cuts, for example, in defense spending and at least two other areas, but they want to focus on deficit.
What they're doing tomorrow in their rules package is actually allowing one person, the chairman of the Budget Committee, Paul Ryan, to set the budget ceilings on his own, without a vote, without any input from any member. That's so that they can automatically impose a rollback in spending to the 2008 spending levels, which means about a 21% cut in education, which means hundreds of millions of dollars in cuts to healthcare research and student loans. So the reality is that their proposed spending cuts are going to harm real people, because the only way to actually really make significant impact on the deficit is if we go beyond just the basics. But they know that that's a political minefield, and for them, what their plan is to go to entitlement reform. Paul Ryan has proposed privatizing Social Security and turning Medicare into a voucher program, and that's what this really is all about for them long term.
But let me move this ball forward, if you will. So everything that I'm hearing from you and what we've heard from many of the Republican leadership and even new faces in the party who are now going to be on Capitol Hill, it's very similar. You had some successes in the lame duck session. The president declared, victorious in a few areas, but this argument and this debate, or these debates, the same, including what we're hearing on health care. So what are your expectations?
Well, our expectations is that the Republicans should come to the table, and again, we'll use the yardstick of whether their proposals create jobs. Certainly healthcare reform, repealing healthcare reform doesn't do that. Whether their proposals reduce the deficit. We're trying to repeal healthcare reform explodes the deficit. Remember, Tamron, healthcare reform actually cuts the deficit by $143 billion, according to CBO, over the first 10 years, and over $1 trillion in the second 10 years. So it fails on that test. It hurts the middle class, because working families are ones that struggle with making sure that they have access to healthcare coverage, and it does nothing to turn the economy around. On the contrary, if you look at the jobs report that came out in December, the number one industry that gained jobs was healthcare. That's what they're proposing to do.
Well, it'll be
reverse all of that.
interesting what this first month looks like, if we will be back where we seemingly started 2 years ago. All right, Congresswoman Debbie Wasserman Schultz, again, congratulations on your new leadership position. We greatly appreciate it.